So you hear that sound and you know it's time for us to verify the claims making the rounds on social media. New tonight, our hope forward is fact-checking if the COVID-19 vaccine itself can be deadly.
Whether it's a tweet from a Georgia representative claiming thousands have died from vaccines or comments from 11 Alive's Facebook, people are questioning if the COVID vaccine is responsible for thousands of deaths. So we checked with the Vaccine Adverse Event Recording System, the CDC, the FDA, and PolitiFact to verify. First, the Vaccine Recording System, which is run by the CDC and FDA, allows people to report reactions after a vaccine. The system accepts reports without verifying if a vaccine actually caused the death. So that's a problem in itself. The system does show it's received more than 6,000 reports of death in people who received a COVID vaccine. But this number is not a tool to gauge deaths, because remember, the system doesn't verify if that's true. The FDA requires healthcare providers to report any death after a COVID-19 vaccine, even when it's unclear if the vaccine might have been involved. An example the CDC gives is if a person with a history of heart problems goes to the ER in cardiac arrest and dies, the hospital is required to report the death and if the person was vaccinated. Then the CDC verifies that cause of death. And the CDC recently said a review of death certificates, autopsies, and medical records have not established a causal link to COVID-19 vaccines. However, it is important to note there was a relationship between the J&J vaccine, which caused rare blood clots, and those blood clots led to at least 3 deaths. But the overall claim that COVID vaccines caused thousands of deaths is false.